I am Dr. M.Sheshu Madhav, Managing Director, Ajara Hospitals, Warangal. This pandemic COVID has shown us all what exactly humanity means. Everyone was sufferer with this pandemic. The most hit in this pandemic throughout the world was humanity. At Ajara Hospital, it was a bigger task for us when it came facing this pandemic COVID. As such, everybody know that this COVID entity was a newer one, and as a healthcare facility, we had a lot of challenges when it came to treating this pandemic. Especially the first issue came is when to refill or reconstitute the courage, the confidence in our own staff, in our own consultants, we ourselves, to get that courage and confidence to treat this pandemic. So at Ajara Hospital, so we had a dedicated beds, dedicated ICU, especially for the COVID-19. The COVID-19, and we proudly can say almost like last 3 months, around 900 patients we have treated COVID inpatients, and as such, in the Tri-Cities, other than the government facility, our Ajara Hospital is the private facility wherein we catered more number of COVID patients. We had lot of COVID entities like COVID with cardiac complications, COVID with renal complications, COVID complicating pregnancies. So we have done COVID cesarean sections. So everything was done under one roof. It only happened because we have a dedicated team of consultants, a team of our intensive team, our ER emergency team, and our on the top of it, the logistics have been maintained by our non-medical persons, especially when it came to our pharmacy, when it came to lab, and starting from our own from the IR to the top, even to the director also, everybody was on the toes to give the best to the patient admitted in the Ajara Hospital. Yes, we had a very, very tough time in treating the patients, in arranging the logistics, in carrying out day-to-day activities. Most of the staff, most of the doctors were also fallen sick to this pandemic. While they are treating, they are being also admitted during this. Almost 30 to 40% of my staff were admitted, and most of my my doctor consultants, my friends were also admitted. So we were doing the best possible way, even though we had an issues with the logistical issues of oxygen, logistical issues of medicines, injections, but we never failed in doing that. We able to cater everything possible, and at the same time we went hand in hand with the district administration in providing whatever the possible help to them, taking their help also, the district administrators also, like district collector, local MLAs, and district medical and health officers. They all were helpful to us in helping us in keeping our patients, treating our patients, and making them healthy and making them happy. As we had been to this last 3 months, and almost all the earlier first phase and second phase also, so we could do our best. We have given our best, and at the same time we have lost our best people also to the pandemic, and it was really a lifetime experience. But at the same time, Ajara stood like a rock and gave its best, especially in the pandemic, and showed that always Ajara will be giving the best possible in the healthcare.